And once again, welcome to Living in the 21st Century. Joining me today is Dr. Alok Sharma, MS, M.Ch, Neurosurgery Director, NeuroGen Brain and Spine Institute, and Professor of Neurosurgery and Head of Department of LTMG Hospital and LTM Medical College in Sion, Mumbai, India. We have Dr. Nandini Gokulchandran, MD, Deputy Director, Consultant of Regenerative Medicine, Head Medical Services, NeuroGen Brain and Spine Institute in India. We also have Mercy Mbogori-Kairichi, profession, molecular biologist, affiliation, stay-at-home mom, reversing my son's autism. And from Kansas City, we have Dr. Francis Karanu, Director of Cell Therapy, R&D from Kansas City. Doctors, I want to say thank you again on coming on Living on the 21st Century. And just briefly, again, reintroduce yourself. Start with Dr. Alok.
I'm Dr. Alok Sharma. I'm a neurosurgeon with a special interest in regenerative medicine for incurable neurological conditions. I'm professor at the University Hospital, and we have our own dedicated hospital, the NeuroGen Brain and Spine Institute, which has been set up primarily to treat incurable neurological conditions, which in children include autism, cerebral palsy, intellectual disability, and in adults includes all those neurological conditions that cause paralysis, like brain stroke, spinal cord injury, head injury, ALS, etc.
And Dr. Nandini?
Good evening, I'm Dr. Nandini Gokulchandran. I'm the Deputy Director of NeuroGen Brain and Spine Institute, and I work with Dr. Alok Sharma. I've been working since last 13 years with him. And my expertise is stem cells and regenerative medicine and focused on incurable neurological disorders.
Mercy Mbogori?
Yeah, my name is Mercy Mbogori. I'm a mother of 3 boys who are autistic. I'm a molecular biologist by profession, and the last 5 years I left my research work to focus on reversing autism in my sons. Thank you.
Okay. And Dr. Francis?
Yes, thank you, Errol. I'm Francis Karanu. I'm a Cell Therapy Director, R&D at Likarda in Kansas City, Missouri. Thank you.
Great. Dr. Alok, you were finished chiming in on our last episode in response to Mercy. Could you finish that off, and then we'll go right into the PowerPoints?
Yeah, so basically, like she said, she has triplets in the same home, the same food, the same environment, and almost similar genes. And yet, all 3 children were different, and they have responded differently to the stem cells. So to reply to the question of Dr. Francis, yes, the response depends on how much, which part of the brain, and to what extent there is hypometabolism in the areas of the brain. And in the case of these 3 kids, the metabolic changes in all the 3 brains were different. And that is why we are seeing a different response after the treatment. Okay. All are improving, but one is almost completely off the spectrum, one is on the way to be there, and the other one is improving as well.
Okay. So in conclusion of that part, you can rightfully say that autistic children can vary from child to child, and response to medication may be different, and they can probably live a normal life, semi to normal life in some instances.
Absolutely. You're very correct. They can. We've been doing this work for the last 14 years, and the children we treated 8 or 10 years ago are living normal lives, in the sense they've graduated from their schools, they've graduated from college, they are making a living, they're independent, they have their speech, they don't have all the other issues. So, the old belief that nothing can be done for autism, that autism cannot be reversed, is no longer true.
Okay.
When you combine cellular therapy using stem cells to repair the damage in the brain, along with conventional rehabilitation, diet, and other treatments, you get close to almost completely reverse autism.
Great. Well, at this point, we want to turn to the PowerPoint, where you would demonstrate and explain to us what's going on. And Dr. Francis, please feel free to chime in at any time in question.
Correct. So I just mentioned that I know we got a lot of slides when they're queued up. So we'll probably touch on some of the points in the slides. So we'll probably do them a little faster. So the person that's queuing the slides can start, and then Dr. Errol can guide us as we go through the slides.
Sure.
Yeah. So I mean that we are going to be talking about autism spectrum disorders. The next slide, please. And what exactly is autism spectrum disorder? We know it's a neurodevelopmental disorder, and it has been described not very, unlike other diseases which are described in the previous centuries. The discovery is more recent. Boys have it 4 times more than girls, and it is now called a spectrum, where it could be mild, moderate, or severe. Next. And the main problems in these children are about communication and speech, repetitive behavior, and social issues. So this is a triad, a combination of these. Each child is different. Somebody may have more of speech, less of social issues. Somebody may have more of behavioral issues, lesser speech problems, so forth. But this is the triad of symptoms. Next slide. And this is just to tell you what it results in. It results in hyperactivity and aggressiveness. They aren't able to have a conventional education. They have these repetitive behaviors. It's difficult to manage them day to day, from the diet to the toilet. Everything has to be managed by the parents. Next slide. Now, what is not known is that the incidence of autism in the last 20 years has literally gone through the roof. 15 years ago, 1 out of 166 children had autism, and now it has come down to 1 in 44. With every year, the incidence of autism is increasing. Okay, and this is something which governments and regulators and policymakers haven't realized. There is something wrong that the incidence of autism is increasing to this capacity. Presently, there are 70 million people on the autism spectrum, which is 1% of the world's population. 1%. That is huge. Okay. And obviously, this needs attention. Next slide. So the diagnosis is, primarily clinical so far. People just go by the symptoms. But what we do is, in addition to the symptoms and clinical evaluation, we also do brain imaging in the form of PET CT scan, MRI, EEG, etc. Next slide. So this is to show you, this is our work that we have done. And what you're seeing is what is called a PET CT scan of the brain. A PET CT scan shows you function as compared to other scans which show you structure. Now, what you see on the screen, what is blue in color, is brain that is working less than normal. The metabolism of it is less. And primarily, this involves part of the brain that, we have a larger brain, the cerebrum, and a smaller brain called the cerebellum. And we found in all these children, the cerebellum is involved, as well as areas in the medial temporal area. So we've actually seen this in more than 3,500 children, and this work is published in the World Journal of Nuclear Medicine. There is a standard pattern today, which means based on the areas of the brain which are hypermetabolic, one can now actually accurately predict and diagnose autism.
So Dr. Errol, quick question there. So newborn children or infants, if they are subjected to these PET scans, can you pick up the diagnosis at birth or neonates, or that it have to be like 2 years or more?
No, so in because we haven't done this, PET scans have not been done in neonates, so we really don't know what will happen in the neonate brain. But in the work that we did, we actually, as part of a study, we took special consent from children who did not have autism, where the PET scan was being done for other reasons in the body, and we looked at the PET of the brain. In not a single child who did not have autism, in other words, neurotypical children, there was no hypermetabolism in the brain. So we've actually studied children with autism and children without autism, and you do not see the blue hypometabolic areas in the neurotypical or normal children. So we know definitely that this is the cause. Also, like you're aware, the brain, every part of the brain has a specific function. Our speech area is a specific area, the Broca's area. Our sensory areas are well defined. Our visual areas are well defined. So in the brain, everything is defined. So when you see this hypometabolism, you know exactly what is the function of that. And we've actually studied and shown that the hypometabolic areas exactly match with the symptoms. Exactly. Okay. Which is why each child is different. So there is an exact correlation between the symptomatology and the parts of the brain which are hyperfunctioning. So this, unfortunately, is not being done to wider extent in the rest of the world, because it's important to see this. And what happens is, when parents see this, then they realize that we are dealing with a medical disorder. Otherwise, people think of all kinds of things. I was told in Africa they believe that it's the spirits that have taken over, and that is and very often all kinds of nasty things are done to these kids. But when you realize, or sometimes the parents are blamed, the mother is blamed, but when you see a scan and you see an area that's not working, and because it's in color, even parents can understand. It's not difficult to read the scan. Now you're dealing with a medical problem, and when there's a medical problem, it can be fixed. Now, the importance of the scan is also that after we do our stem cell therapy, we repeat the scan after 6 months, and you see that all the damaged area gets resolved. So this is objective proof that the treatment is working. So that's the advantage of the scan.
Thank you.
Next slide, please. Now, the one thing which I think all parents of children on the spectrum should know is that there is no silver bullet. There's no one single silver bullet that will cure autism. There is a multidisciplinary approach. So you need to do everything. This will start with all types of rehabilitation. Whether it is occupational therapy, speech therapy, behavioral therapy. There are newer forms of therapy like aquatic therapy, dance and art therapy. Then there is diet. There are other treatment. There are so many other newer treatment forms like hyperbaric oxygen. And stem cell therapy is one part of the overall treatment. So we have to do all of it. Just stem cell therapy doesn't help. It has to be combined with all these other treatments. Next slide. So amongst the therapies that we have is applied behavioral analysis, ABA, where the basic idea is that for every behavior, there is something that precedes it and there is a consequence. And when you modulate that, you can change behavior. In the United States, ABA is the frontline treatment for children with autism. Almost every child with autism is advised this, and there are very, very good results with ABA itself. Next slide. Then there is occupational therapy. Occupational therapy looks at the child more holistically. And there are multiple aspects over here, from their looking after the activities of daily living to looking after various sensory issues. So occupational therapy has a very, very important role to play along with ABA. Next slide. And then there is sensory integration therapy, which is a part of occupational therapy actually, because a lot of the children with autism have several sensory issues, and they have abnormal behavior because their sensory perception is not like others. So sensory integration therapy helps to resolve the sensory issues. Next. Then speech therapy is of course very important. Now the older view was that speech is only about verbal talking, words, sound. And the newer thinking is more than words, it is communication. The child should be able to communicate using words and using whatever means possible. So the shift is shifting from speech to communication. Next slide, please. Now, it was earlier believed that physiotherapy has no role in autism. However, we have found that several of these children have gait issues. They have issues with the muscle tone. And we believe that physiotherapy has an extremely important role to play in the management of autism. Next slide. Next. So this is just to show you what we do, stem cell therapy. The word stem comes from the stem of a plant or a stem of a tree. And just like from the stem of a plant, branches and leaves and flowers and fruits are formed, likewise, there are some cells in the body from which all the other cell types could form. And these cells are called stem cells. Next slide. And like I said, the action is that they have the ability to multiply. They divide, then they multiply. And when they divide, they make a copy of themselves, but they can actually differentiate into any other cell type. So this property, the ability of a stem cell, so the same stem cell, depending on where it is put, could become a nerve cell or a heart cell or a muscle cell or any other cell type of the body. So that is what is unique. A cell that can multiply and grow, and a cell that can differentiate into whatever you want. It also improves the blood supply as well as releases these positive growth factors that are very helpful in healing damaged tissue. Next slide. Now, we actually are working with adult stem cells. So what has actually happened, and this is important to understand, is stem cells in 1998, they had discovered stem cells from the embryo. The embryo is the fetus in the mother's womb, after conception, and embryonic stem cells are made from that. Now, due to certain religious issues, the use of anything from the embryo was not acceptable, not considered ethical. So in America, President George Bush, he banned the federal funding of research for embryonic stem cells. All right. Now that people remember, all right, because that stem cells were banned in America. But what did he do? He only banned the federally funding for embryonic stem cell. But stem cells are of different types. You have stem cells that come from the umbilical cord. You have stem cells that come from your own body. Also, what most people don't remember is that President Obama, when he became president, one of the first executive actions that he took was to lift that particular ban. So that ban no more exists. But it's important to understand that broadly speaking, stem cells can be divided into two types, allogenic and autologous. Allogenic is stem cells taken from somebody else. Okay, so in that now there are different types. It could be taken from the embryo, it could be taken from the placenta, from the umbilical cord. There are different types. Autologous, primarily either you take from the bone marrow, or in some cases it is taken from the fat. So the fat and bone marrow have stem cells. So we do not use allogenic stem cells. We use autologous. We prefer to use autologous because we believe that they are safer. We have also seen better results with autologous than what we have seen other people who are using allogenic, simply because the body is more likely to accept its own cells. So what we do is, we take stem cells from the child's own bone, separate the bone marrow, separate the stem cells and put it back. Why do we do it? Because it's safe. They do not form tumors, which could happen potentially with embryonic stem cells. Adult stem cells have never formed tumors because, in fact, bone marrow cells have been used for several years to treat blood cancers. They never get rejected because they are your own. You can get it through a simple needle prick. It's not very difficult to get it. And there are no ethical issues. Next slide.
So Dr. Sharma, a quick question here on the stem cell. I know the FDA, at least in the US, is the regulatory body here. And I know probably there's a different regulatory authority in India that takes care of that. Or do you go by FDA standards? Because FDA standards in stem cells, especially with the autologous stem cells, that's the most feasible way, because and what they'll say is that unless the cells are minimally manipulated after they removed from their body. So can you just talk very briefly about regulatory?
So what you said about minimal manipulation, the US FDA itself says that when cells are minimally manipulated and autologous, they actually say they do not come under, the FDA. If you see the FDA regulations, there is a sentence that very clearly says, so what we are using is autologous minimally manipulated. Now we have, in India, we have an FDA. Each state has an FDA, and there's a central body, a central thing that is called the CDSCO. That is like your FDA. Now they have very clearly, what they have done is they have separated stem cell derived product from autologous minimally manipulated. They have made a definition and said that if you are processing the cells, if the cells are allogenic, if it's not minimally manipulated, then it is a new drug and it comes under FDA regulation. However, They have very clearly in a set of rules said, if you take from the patient and put it back in the patient, and your cells do not leave the hospital premises, there is no something from the outside coming in. Okay, you do not fall under the FDA regulations. We have something called the Drugs and Cosmetics Act. So autologous minimally manipulated, although it is there in the US FDA itself, but it's not being practiced there. Our thing says exactly the same thing. If you're taking from the body, putting it back, and you're doing a minimal manipulation, that means you're not growing, culturing, anything else, then it's outside, and we can do it with the permission of FDA registered institutional ethics committee. So we have you call it IRB, Institutional Review Board. So here we call it the Institutional Ethics Committee. It's our IRB. But this IRB has to be registered with our FDA. So there is an indirect oversight. FDA registered IRB monitors the work. So that is the oversight. Now, if you use allogenic cells, you can't do it without FDA clearance. So in fact, we had used allogenic cells for COVID. When COVID was active, we had actually given intravenous umbilical cord based cells. Now there, we had to take permission from the FDA because we were using allogenic stem cells in COVID, of which we got excellent results. And that's going to be published shortly, our results with a phase 1, phase 2 clinical trial over there. So in India, minimally manipulated autologous, it is out of the purview of the FDA.
Okay.
The jurisdiction of your institutional ethics committee.
Okay. So I think you've given a good pivot here. I know you have very interesting slides, but I think we can probably discuss in pivot here to the COVID-19. Can you talk a little bit about any links that you have seen in terms of autism and COVID-19 prevalence or infections or comments on that?
No, just repeat the question and get the question.
We talked about COVID-19 and autism. I'm trying to see, have you seen any links between the two, and can you have any comments, especially for long haulers in COVID infections?
No, we haven't seen a link between autism and COVID right now. What I told you, what we had done is at the university hospital, we were treating COVID patients, proper COVID patients with the primary pulmonary involvement. So for pulmonary COVID, we had used umbilical cord based stem cells. Those were injected IV. So that's separate. That's a separate thing where we use stem cells for COVID. And what I wanted to make is the distinction. There we used manufactured allogenic stem cells that were manufactured by a company, and so we came under FDA, and so to do that we needed FDA approval. Whereas our FDA very clearly says if you take from the patient, put it back, you do not come under our purview. That's what our FDA says. So, but we haven't seen a correlation between autism and COVID because I think it's too small. By the time the diagnosis made is 2 or 3 years. So maybe in the future we'll see something, but there's nothing that we...
Okay, I know in the interest of time also, we'll probably talk about your advice in terms of global resources. What is out there for families like Mercy and people like that? What general advice is there, and how they can get help in terms of seeking treatment for their children?
Yeah, so at our institute, we have treated children with autism from 70 different countries. From all over the world, people are coming to us. What makes us different from any other stem cell therapy center in the world is that we do only neurological patients here. So we are dedicated neurological, and we combine stem cell therapy with rehabilitation. We have a very extensive rehab program, all the things that we showed you there. And we also combine this with what is called integrative therapy. So we're using hyperbaric oxygen therapy, ozone therapy, supplementation of vitamins and minerals. So we are using a very wide combination of treatments all together. So that is what makes us sort of different, and we welcome people from all over the world. Once they come to us, the treatment is done. we help people across socioeconomic strata. Again, for us, nobody is refused anything for financial reasons. We try to see how we can help them. We have some corporate social responsibility, like any orphan child is treated without any cost. Children who come from very rural areas, tribal areas, very poor children, they are treated at highly subsidized on no cost. So we have a corporate social responsibility for people from the lower social group. So nobody is denied treatment.
Yeah.
Of course, those who come through the regular channel, it gets done faster, and those who need support, it may take a little time.
Real long, right? Yeah.
But nobody is denied treatment.
Yeah. I know Masi might also have some final thoughts.
Yes. So, Dr. Alok, we're on our last 2 minutes here, and we barely scratched the surface. I want to bring back, if possible, your team back in 2 Saturdays from now, right? If that's fine, we can set up that into. That's fine, beautiful. Because I think there's so much I want to get into, considering we are in a world with so much autistic kids. I mean, they're like, just can't even compare the amount of numbers right now. But one question is, who's the leading or pace setter right now in autistic and stem cell research? Is it US, is it China, or is it India? Which one?
Right now, it's India. Because we have the world's first paper, scientific published paper. We've got 2 clinical studies that are published, and a total of 15 papers, 15 scientific papers, chapters in medical textbooks, and the largest clinical experience. So we have treated a little over 3,500 children. And I know for a fact that there is no other center in the world that has treated successfully and safely over 3,500 children. So the leadership is definitely with us. I think after us is China, where they've also done, there's a large work happening, but there is no single center that has done as much as we have. Japan is also doing some work. There are some countries in Europe. I mean, there's work happening in Italy and Ukraine, etc. And now it has started happening in America. So America is about 10 years behind us.
Okay. Well, Dr. Alok, it's a pleasure having you on, and the theme. Definitely, we're going to schedule a next interview for the next 2 weeks. And it really was a pleasure going into this in depth on autism and stem cell research. And for all those who have been tuning in or living in this 21st century, I want to say thank you. Have an enjoyable day. Bye-bye.